There are two current main approaches to rhinoplasty. One is the so-called open approach, where an incision is made in the columella and the skin is lifted up so the surgeon can get right at the skeleton. And the other is the closed approach, which I do exclusively. The closed approach allows much more limited access. I don't uncover anything that I don't want to change. I can limit my incisions and limit my dissection, and that's particularly important for patients who've had multiple prior surgeries. It's a misconception of many surgeons that the way to get a great result in rhinoplasty is to see the skeleton perfectly. So the bigger the exposure, the better they have of the skeleton. That's not true. The skin is half of nasal shape, and so the skeleton is really a means to an end. So not only am I decreasing the recovery and decreasing the chance of an imperfect result, but I have a much better chance of seeing what the nose looks like on the table, because the skin is in its resting position and I'm seeing the skin component of the nasal contour, which is what the patient sees. Regardless of what I tell patients about the recovery, they expect it to be longer than it is, particularly if patients have had prior surgeries and prior open surgeries. The closed approach allows me to dissect only the areas that I plan to change, and so the recovery is quicker. We take the packing out at a week, and the breathing is instantly better. The nose may look a little puffy, but it's presentable, and most patients are able to be out in public, out to dinner, back to many activities within 7 days.